NHS Scotland has almost 170,000 staff, and we serve a population of almost 5.5 million people. We are the largest employer in Scotland. Just over half of our staff are clinically qualified, but did you know that just under half support those clinical roles and also provide critical and crucial support to our infrastructure? Do you know how many job roles are actually in the NHS? Roles include everything from healthcare science, business and administration roles, including finance, medical reception and project management, estates and facilities roles, such as catering production assistants and domestic services, and clinical roles, including allied health professions, pharmacy, nurses, and medical staff. There are many routes into the NHS, from pre-employment programmes, including partnerships, such as Prince's Trust, volunteering opportunities, and work experience. We also offer apprenticeships at all levels: foundation apprenticeships, modern apprenticeships, and graduate apprenticeships. There are a huge variety of pathways that widen access into the NHS. Generally, our education programmes require national 4 or 5 qualifications for entry. Many ask for specific subjects depending on the apprenticeship award and level. If you don't have these qualifications, however, there are still lots of opportunities to apply for many entry-level support roles. Our focus is on the right person. We can teach you many of the skills you will need, but we need to know that you share the values of NHS Scotland. We want to know what matters to you. Are you caring? Are you honest and like to take responsibility? Do you want to be part of delivering a service and care that is really high in quality? Do you want to work together with other people in teams? And is it important to you to act with dignity and respect? Can you think of a skill you have that you could use in the NHS? Always remember, everyone is different. You can all bring something that no one else can.
My name is Rebecca Martin and I'm a mental health support worker. I work at East Lothian Community Hospital. I was attracted to working in the NHS because my brother's got autism and I wanted to help other people. My day-to-day role is helping people with mental health to do daily activities such as going shopping, going to the gym and helping them with some paperwork. The most important skills to make sure I do my job well is listening and communication and making sure that I'm being patient.
I'm Declan Kemp, I'm a clerical officer, I work for the sick kids and I'm under NHS Lothian. My day-to-day role in the A&E office would be checking in patients. We're normally first contact for the patient. We send out letters to the GPs, we authorise clinic notes from doctors and consultants, and we also just recently took on scanning for files of the A&E patients. The most important skill is to have a calm manner. That's a big one. I would say that's probably the forefront of the skills that you would need to do my role. The second one being attention to detail. You don't want to be booking in the wrong patient and you need to have the right addresses and the right patient at the right time. There's so many opportunities in the NHS, but with my skill set, I believe that I would want to go into e-health or into the IT of NHS.
My name's Amy Finlayson. I work as a Band 3 healthcare support worker in Physio at Home in NHS Lothian. I was attracted to working in the NHS, specifically in my role because it encompassed all the things I really enjoyed at school and it gave me an opportunity to put everything that I knew about that into practice in a way that was going to help people. My role is 50% admin, 50% clinical, so in the morning I will answer emails, I will put on referrals, I'll change things about on waiting lists. Also, I run the phone service for Physio at Home. More in the afternoon, I'll move on to my clinical side of things. So I'll go out to see patients that are on my own caseload. I might do double visits with people and do kind of notes and equipment provision and things like that as well. So the skills that I feel are most important, one of the main ones is communication. You're communicating on a daily basis with many different people, whether it's health professionals, patients, their families, and it's really important to understand how other people communicate and learn and take information in. It's really good to have the knowledge and everything and the understanding of, biology and things, but people skills is a really big thing as well, because you're going in to see people usually after some kind of trauma, a fall, something that's a really quite scary experience, and they're quite vulnerable, so you need to be able to build that relationship with them.
Skills come from many experiences in life, not just those that you pick up at school or college. We may be in unprecedented times. The NHS may be facing some of the biggest challenges that healthcare has ever seen. But this also means that there is great opportunity to join the NHS at a time when you can really make a difference. Do you want an amazing career? Do you want to make a difference not just to individuals, but also to the health and well-being of our society? Do you want to be part of something that really matters?